How do I check if my prescriptions are covered under my drug plan cap? In recent news, many individuals are seeking clarity on their prescription coverage as they navigate their Medicare drug plans. With changes in legislation and updates to coverage options, it is important to stay informed. If you are wondering how to check if your prescriptions are covered under your drug plan cap, you are not alone. This is a timely topic that affects many people currently enrolled in Medicare. To begin, the coverage of your prescriptions depends on the specific Medicare Part D plan or Medicare Advantage plan you have. Each plan has a formulary, which is a list of covered drugs. You can find this formulary on your plan's website or in the materials you received when you enrolled. This list will show which drugs are covered and any restrictions that may apply, such as prior authorizations or step therapy requirements. Next, take advantage of your plan's online tools. Most Medicare drug plans offer these tools, allowing you to enter the name of your medication to see if it is covered and what your cost will be. These tools can also indicate if your drug is subject to any special rules or limits. If you are still unsure or cannot find your medication on the formulary, consider contacting your plan directly. Calling your plan's customer service can provide you with confirmation on whether your prescription is covered and how it applies to your out-of-pocket cap. It is also essential to understand the out-of-pocket cap under Medicare Part D thanks to the Inflation Reduction Act of 2022. Starting in the year 2025, Medicare Part D plans will have a hard cap on out-of-pocket costs for covered drugs set at $2,000 per year. This means that once you reach this amount in out-of-pocket expenses for covered Part D drugs, you will not pay more for covered prescriptions for the remainder of the year. However, keep in mind that this cap only applies to drugs covered under your plan's formulary. To check if your medication is covered under the cap, remember that only drugs covered by your Medicare Part D plan count toward the out-of-pocket cap. Some medications may not be covered or may have restrictions affecting coverage. For example, drugs prescribed for weight loss, like semaglutide, are generally not covered under Medicare Part D unless prescribed for other medical conditions. Lastly, consider utilizing resources like state health insurance assistance programs. These programs offer free, unbiased counseling to help you understand your Medicare drug coverage and costs. They can assist you in checking if your prescriptions are covered and how they count toward your plan's cap. To summarize, checking if your prescriptions are covered under your Medicare drug plan cap starts with reviewing your plan's formulary. Use online tools or customer service for confirmation. Remember, only covered drugs count toward your out-of-pocket limit, which is capped at $2,000 in 2025. If you need additional help, state health insurance assistance programs provide personalized assistance. This approach will ensure you know which medications are included in your plan's coverage and how your costs will be managed throughout the year.